Our next speaker is Dr. Pocholo Trinidad. His talk is titled A Study Protocol, Cultural Adaptation of a Standardized Patient-Related Outcome Measure, Prom, tool for patients using prostheses and orthoses in Filipino. Dr. Pocholo, please take the floor.
For prosthetics and orthotics. Okay, so a pleasant good afternoon to everybody. Nowadays, we place a lot of importance on patients because a patient is the most important member of the healthcare team. And more often than not, like as a clinician, whenever we see a patient, we usually discharge the patient and we don't see the patient after quite some time until such a time that the patient again complains of, let's say, something. And we usually lose our patient as a result of the follow-up. And this phenomenon actually inspired us to come up with a research in trying to come up with a follow-up with a specific population of rehabilitation patients, those who are using prosthetic and orthotic devices. The main objectives for our topic is primarily to describe an overview of the basic concepts of patient-reported outcome measures and your patient-reported outcomes. You want to present an overview of the study protocol and describe the status of our research, which we are currently developing. As I mentioned to you earlier on, the patient is the center of the healthcare team, and he is considered as the most important member of the team. And patients are the best judge of their own welfare. Currently, there is much interest in trying to come up with patient-reported outcome measures in order for us to support improvement in the healthcare delivery as well as the safety of our patients. And like, for example, right now, whenever we see our patients, what's the usual thing? Whenever we have some, let's say, complaints about something, a patient is attended to by an attending physician and often referred to other specializations. Nowadays, after the primary physician has discharged the patient, what happens? Even the other specialists won't have the opportunity to really make a follow-up. It's only the attending physician. Now, the question there is, should they make a follow-up of the patient? And there is so much complexity in the healthcare delivery that we have to focus now on the patients because there is an increased integration of health systems worldwide. And we have to manage patients using a patient-focused manner. I guess I'm partially guilty of this. I've been a family physician for how many years? For almost 23 years. And traditionally, when I see the patients, I discharge them, and I don't see them until probably 3 months after, 4 months after. The question there is, should I call them up and ask them from time to time, how are you doing? Have your symptoms been resolved? Have they been relieved? And more often than not, we lose them in the process. So clinicians are basically limited in accurately estimating the outcomes for their patients. Now, the missing link in trying to document the outcomes is what we call your PROM, or your patient-reported outcome measures. So what is a PROM and what is a PRO? When we talk about patient-reported outcomes, we are referring to any information that the patient would provide. For example, the patient is asked about what is the severity of your pain right now? Or have you improved after taking your medicines from the last time we saw each other? So it is an information provided by the patient without any manipulation of the information given by the patient. The doctor would not say, oh, you improved. But that's what the doctor said. It did not come from the patient. Okay, so it is an objective way of making a follow-up for our patients. When we talk about patient-reported outcome measures, we need to document the outcomes. So it comes in the form of a questionnaire. It's a standardized or a structured questionnaire that tries to highlight the status of the patient's health. It can come in the form of, let's say, an experience of the patient, the health behavior, or even the healthcare that comes directly with the patient. Now, if you try to look, is this evidence-based? Yes, a large amount of information would show that PROMs are primarily an evidence way of documenting a patient's health condition. And we have to keep the patient in the picture. Why? More often than not, who plays the central role whenever we see the doctor? It's the doctor. The patient becomes an active participant. The patient is an active, a passive listener in the process. We have to make sure that the patient is well recognized and he has to be heard, because we have to listen to his perceptions as well as his own health conditions. And that is the future trend right now. We have to document the patient with what his experience would often dictate. So what is the rationale for using a patient-reported outcome? Number one, it enables us as patients, clinicians, and families to make informed decisions about the healthcare. Secondly, we're able to monitor the progress of the patient care. Third, we're able to improve the quality of healthcare services. Number four, if you are staying in a hospital and you want to monitor your patients, you can use the data and track the performance of your consultants. And fifth, it can serve as a basis for policy enactment and coverage related with reimbursement. So, how many themes are there? Now, in the past decade, there were several countries which have been at the forefront of developing their PROMs. You have the UK, the United States, we have Sweden, and the Netherlands. And each country focuses on specific types of PROMs over the years. Like, for example, in the UK, they came up with PROMs measuring hospital performance in selected surgical conditions. In Sweden, they came up with PROMs for chronic conditions, while for the Netherlands and the United States, they came up with numerous PROMs for certain specific diseases and clinical conditions. As a whole, there are several types of PROMs. We have the generic type, disease-specific, dimension-specific, region and site-specific, individualized, utility measures, as well as the summary items. Now, usually, when we look at the PROM, they are standardized and structured, okay? And they consist of items which represent a series of constructs. It can be pain, symptom, or the quality of life. And it is often a form of self-assessment for the patient, which tries to measure a certain construct along the continuum. For example, we like to determine whether a patient still has pain after several weeks. So if you show them a scale, probably, and ask them, can you indicate in the scale, do you still have pain right now, or has the pain disappeared? And the pain will indicate along the continuum whether he has still the pain or not. And a scale may be composed of pictures, numbers, and certain categories. And we obtain this through questionnaires, an interview, or a combination of both questionnaires and interviews. So the scales may be composed of a Likert scale. It can be in the form of a visual analog scale, a categorized anchored visual analog scale. We can have a pictorial scale in the process, a rating scale, or even a checklist. This brings about why we want to do the study. So we want to apply a PROM for a specific group of individuals, those requiring a prosthesis and an orthosis. What is a prosthesis? It's an artificial body part. Okay, it can be an artificial limb. It can be a breast implant. It can be an artificial ear. Okay, so all of anything which is artificial and it replaces a certain body part is considered a prosthesis. What is an orthosis? How does it differentiate from a prosthesis? It is an artificial external device attached to a limb or the spine in order to assist or prevent any relative movement of that body part. So we are focusing on those type of people using such devices. Now, We know for a fact that a lot of people who use prosthetic devices have been using it for a long period of time. Therefore, we have to monitor them in terms of their use. It's very crucial for us that we identify and determine the level of satisfaction. Not only that, but in order for us to ensure that the quality of life improves throughout the time that they are using the device. Now, of course, we're going to do it in the Philippines. Basically, the Philippines is an archipelago. It's made up of around 7,385 islands divided into around 12 regions. And despite the fact that it is a diverse country, there are around 181 languages scattered all over, when 4 of them are extinct. And Filipino and English are considered the national languages of the Philippines. And considering with the picture, the population is also as diverse. Now, at this particular time, we would like to note that the use of prosthetic and orthotic PROM, there has not been a single PROM done in Asia, in the whole of the Asia-Pacific region. It has been translated into Swedish, Polish, Slovak, and Italian. And it's very crucial for us to develop one which addresses the need for people with prosthetic and orthotic devices in the Philippines in order for us to have an impact and improve their rehabilitation opportunities. So far, there is no instrument use available for prosthetics and orthotics in Asia, and it will be the first in the Asia-Pacific region to adopt such an instrument. So the OPUS is considered as the only measure that explicitly assesses the patient satisfaction in the field of orthotics and prosthetics. And we would like to focus on the 4th module of the OPUS, which is a 21-item survey consisting of a Likert scale, and it's very easy to administer. We're concentrating on the 4th survey because the OPUS consists of 5 surveys. And usually, it's a self-reported questionnaire. It can be administered through the clinic, which is the preferred method. And likewise, we can give it in terms of its individual components. We just have to distribute it, and we need a pencil, of course, to answer it. It takes around 10 to 15 minutes to answer. And the Icf Classification domain of the OPUS is that it involves activity, participation, and empowerment. ICF refers to the International Classification of Functioning Health and Disability. It is the framework by the WHO to ensure that we're able to measure accurately health and disability for an individual and a certain population. It can be both used in the clinical and for research settings, and it can be used for both experimental and quasi-experimental research designs. And it can be used for all ages, basically. And this is an example of the OPUS, the original version, the English version. So therefore, our main objective is to conduct a cultural adaptation of the OPUS into Filipino. Now, the primary challenge was, where do we get the OPUS? Okay, and we were very privileged to write to the original author and developer of the OPUS. It's Professor Allen Heinemann from Northwestern University in Chicago. And he is also very much involved with this research because we wrote to him. I wrote the letter myself asking for permission, and I gave the rationale why we needed to develop a Filipino version for the OPUS. And we were very much elated when he replied back, and he gave us permission to conduct the research accordingly. And he wants us to have a peer review of the OPUS within the year. And we wrote to him last year, and he's very generous in providing all the information that we needed for the conduct of the research. So likewise, we had to choose an area in the Philippines. We patterned the research after the Italian model, where they chose one area where most of the patients would go for prosthetic and orthotic rehabilitation therapy. And in that model, all patients were surveyed. We made use of the same methodology, and the school or the facility which gathers all of these patients were managed by the University of the East. And we had to secure an ethical approval from them, and we submitted our ethical needs. No? We submitted our protocol, and after 2 attempts, we were able to secure the ethical approval because they needed a detailed proposal. So we were able to secure the proposal last December. Now, in terms of methodology, we have to translate, and we followed the WHO guidelines for adaptation and translation, consisting of the following steps. We have completed the first step, the forward translation, the expert panel back translation. We finished the pre-testing and cognitive interviewing, and we've also completed the final version. We've done the pilot tests after the translation, and this is the result of the pilot test. And when we had the results of the pilot test, we did the Cronbach's alpha analysis, and we obtained a very high score of around 0.895 and proceeded to do the final version of the Filipino version. We're conducting it at the Philippine School of Prosthetic and Orthotics Training Center. It's the only school and one of the fewest schools which offers a Bachelor of Science in Prosthetics and Orthotics in Asia, and run by the College of Allied Rehabilitation Sciences in the Philippines at UERM. Sampling will be done through convenience sampling, and we intend to gather all of the patients in that facility, and those who are prompted to be included in the study will be those who are 18 years and above, those who use an orthosis and a prosthesis with orthopedic, rheumatic, and neurological conditions, and those excluded will be those with reading disorders, those with diagnosed cognitive disorders, and those who cannot understand the local language. So, current status, we've done almost everything, and we will be conducting and implementing the research on June because the facility is closed for summer. And right now, of course, we had prepared an informed consent in both Filipino and in English. Likewise, we will be giving them 10 minutes to answer the questions, and survey questions will be collected upon completion, and we will ensure confidentiality, both electronically and physically. No? We will be keeping the contents into a file cabinet. We were lucky that Dr. Heinemann has been with us and provided us with the rash analysis and the factor analysis for the data. And so much effort has been done and given into this research, and I'm very lucky that we did a collaborative research since last year for the investigators. We had recruited one physiotherapist who became a prosthetist and an orthotist. We have the dean of the college, she's working with us. Likewise, Mr. Dennis Tonko and Ms. Liti Shubu have been very instrumental. And we also recruited orthotists based in the United States to help us with the technical details of the survey. He's the only licensed orthotist in Texas right now, and he's Filipino, Mr. De Vera. And we're very happy that we're almost done with the research, and we will be submitted for peer review as soon as we complete the analysis. Likewise, I'm very happy to announce that in the pipeline also, we're doing collaborative research with the PROM, with 2 important people. We're doing one, and we're investigating of doing a PROM for spinal cord injury patients with a classmate of mine who's a faculty member of the U Lulin School of Medicine at the National University of Singapore. And another classmate of mine who is the assistant dean of the David Geffen School of Medicine in UCLA. And he's very much affiliated and very much, he's a Harvard fellow, and he's very much concerned with dementia and geriatrics. So we're trying to do a PROM also for that in application with, of course, the Philippines. So hopefully those 2 collaborations would also work out in the soonest possible time, which we intend to pursue. Again, I would like to thank the opportunity for giving me the opportunity to talk right now. And I'm glad that we should be able to have an impact on the kind of research topics that we're able to publish and present. I think that's the most important thing, the application of these researches in our respective communities. So, a pleasant good afternoon to thank everybody.